If you are looking to prepare for ACL surgery, this video aims to provide some valuable insight for you. I'm a physical therapist of 7 years, and I'm also a former Division I athlete. In January 2025, I went on a ski trip and tore my ACL almost immediately. An MRI confirmed the tear, and I've elected to proceed with surgical reconstruction using a quad tendon graft. About 10 years ago, I had my first ACL reconstruction on that same knee, at that time with a hamstring graft. Going through ACL surgery again, but this time as a physical therapist, I had a very different experience compared to my first surgery back in 2012. Today, I want to walk you through my personal experience on things I thought were helpful, what I don't think you actually need, and what I believe are absolute must-haves if you are preparing for ACL surgery or if you're managing patients who are. First, I'll start with the things that I thought were helpful. The first two would be this stretch-out strap and a foam roller. Now, I obviously have access to these at my clinic, but I chose to go ahead and purchase both for home use. Early on, the foam roller was used constantly for extension propping, which is critical for restoring knee extension after this surgery. It was also used to help with applying the brace and wrapping the compression sleeve post-operatively. The stretch-out strap was invaluable when I had zero quad function in those first few days. As you can see, it allowed me to assist my leg through movement when my muscles simply wouldn't cooperate. The multiple handles make it easy to position my leg from different angles. I went with a smaller version of the foam roller for home, and honestly, I've used it for just about everything except actual foam rolling so far. Another helpful tool was blood flow restriction therapy. Because I'm a physical therapist, I again had access to this in the clinic. If you're entering rehab, I highly recommend seeking out clinics that offer BFR, as it can be extremely beneficial early on when traditional loading isn't an option. Next, my surgeon recommended this antiseptic wash before surgery, as well as this knee sleeve. I will say the sleeve was very comfortable under my brace and helped prevent skin irritation from the stitches early on. I've continued using it well beyond the early post-op phase. The compression is mild but comfortable, and it provides a nice sense of proprioceptive feedback and perceived stability. I've tried several other over-the-counter options, and this one feels like it's worth the price to me. It's much more comfortable, and although it's a little pricier, I definitely think it has longevity and has withstood the test of time. I've started recommending it to my patients. Other things that are helpful is preparing for sleep setup. I used a long body pillow and a neck pillow such as one you would use on an airplane. I'm not naturally a back sleeper, and these things helped me stay compliant with sleeping in my locked extension brace without constantly fighting discomfort. In my personal opinion, you don't need one of the fancy ACL pillows that is highlighted on the internet. I think just a regular body pillow would do just fine. Next, this step stool falls in the helpful but not necessary category. Early on, I struggled with heel slides, which is an exercise I often give to my patients that have had some type of knee surgery. It was weird seeing how I myself really couldn't do them, especially the first 3 days after surgery, when restoring knee flexion gently is important. I ended up using the stool to prop my leg up and rock back and forth, which is how I made the most early progress with knee flexion. I had a partial meniscus repair, and so I wasn't allowed to even bend my knee past 90 degrees the first few weeks anyways. Another thing that was helpful, almost necessary, but particularly helpful for home use, were these resistance bands. I used them in the clinic, but I went ahead and bought a set for myself at home. I used them early on for things like terminal knee extension, and later for a little bit heavier loading, such as Spanish squats, isometrics, and glute retraining. Since I don't go to a gym, I usually work out with what I have access to at home. These allowed me to continue progressive loading in a meaningful way. Later on in the late stages of rehab, I did use them for some initiation to plyometric movements as well. Now, lastly in this category, I strongly recommend having some kind of hobby. As I will talk about later, this surgery takes a serious toll on mental health. No matter how active or motivated you are, you will need time to rest and heal. Having things to do early on, such as reading, watching shows, doing puzzles, painting, Anything that keeps your mind engaged and not hyper-focused on your knee 24/7 will make a huge difference, and it's good to go ahead and start preparing for that. Now, let's talk about things I don't think that you need. First would be expensive ice machines. If you feel pressured by insurance, the hospital, or even your surgeon or therapist to buy a fancy unit, I don't think it's necessary. The hospital sent me home with a basic cold therapy system, and honestly, a large ice pack provided better pain relief. The reason these ones, especially this cheap one from the hospital, is nice because it cools by a method of convection, meaning the constant circulation of the cold water instead of conduction, where once the cold transfers to your body, it is no longer cold and providing the same analgesic relief. Even still, I'd say that you're only supposed to ice in increments of about 20 minutes at a time, and so either method is fine, but it's not necessary to buy an expensive ice machine. Next would be compression sleeves or boots. Compression itself is important, especially for swelling and deep vein thrombosis prevention. But I didn't find these standard sleeves particularly helpful. These again were issued to me by the hospital and maybe provided some proprioceptive relief, especially with the discomfort in the earlier days, but not necessary. If you do have access to higher end compression systems, as you will see in some of the fancy athletic pro athletes use, they can improve comfort, but in my mind, they're not essential if cost is a concern. Next would be this pre-surgery knee brace. I bought it for peace of mind and proprioceptive input, especially for stability after confirming the tear on an MRI. I don't regret having it, but I don't think it's necessary and probably an excessive purchase. The same goes for fancy knee extension devices. Some of these will be advertised on social media, or you might see them at your physical therapy location. Some clinics have expensive tools, but nothing replaces hands-on work. You can creatively use household items for extension propping, and nothing is going to replace active movement and quad activation for extension. In my mind, that's an excessive spend of money. Now, this is the category you really need to pay attention to. Absolute must-haves after ACL surgery. First would be some form of EMS or NMES electrical stimulation. Whether this is at home or readily available in a place you are attending physical therapy, this is essential for quad recruitment after ACL surgery. Swelling and trauma inhibit quad activation no matter how strong you were going in. This tool was by far the most beneficial thing for me in the early days and is something I continue to draw on even months post-operatively. Initially in my career, I thought relying on NMES was unnecessary, and I was wrong. The faster you reestablish that brain-muscle connection, the smoother and quicker your rehab will go. If you don't believe me, look up videos of some bodybuilders undergoing this surgery and see how much their super strong quad is inhibited in the first days after undergoing a knee surgery. Next would be crutches. Make sure your hospital sends you home with them. Even if you feel capable, offloading early is crucial, especially if there's any type of meniscus involvement. Make sure you're following the protocol because the healing depends on it. Nutrition is another must-have. You need some type of plan. There needs to be adequate protein intake, proper hydration, and overall consistency. Creatine has good evidence for muscle recovery, but none of this works in isolation. What you eat and what you do overall matters. So if you are really good about getting your protein in, but continuing to eat a lot of junk food, that's going to have an adverse effect on the outcomes of your surgery. Next, and arguably the most important in my opinion, whether I'm biased or not, is access to high-quality physical therapy and appropriate equipment. If you want to return to sport or high-level activity, subjective progress is not enough. You need objective data. That means having access to things like isometric, isokinetic testing, force plates, and options to load heavy, not just bands and body weight. Pain levels and how it feels don't tell you whether your surgical leg is truly ready. If a clinic or a clinician cannot clearly explain your daily, weekly, and long-term progression or doesn't have the tools to measure it, you should consider looking elsewhere. The rehab is not linear, and data is what guides safe progression. I have athletes come from other clinics or other places they've been doing therapy to at least come in for their 6-month, 9-month, and 12-month check-ins just because they have access to the equipment in our clinic to do so. Start researching now, figure out where you plan to attend therapy, establish an early plan of care. Are you going 3 times a week? Are you going twice a week? What are you supposed to be doing on your days off? And what is it going to look like long term? If you're like me, I had surgery earlier in the year and I had met my deductible. Therapy essentially becomes free because I spend so much money on other things. If you're having surgery at the end of the year and the cost is going to be something that affects you when everything starts over in the beginning of the year, you definitely need to have clear established guidelines on what you're expecting. You might find that it's more valuable to be spending repeated money on being able to attend physical therapy than to slack off just because you think you're saving money. The end outcome is that the objective data from some of the equipment that would be utilized in a clinic setting is going to be very important for how you are doing overall and to reduce the risk of re-injuring your knee. This is something that multiple healthcare providers will vouch for. I myself am a physical therapist. I am married to a physical therapist, and I still relied on going to physical therapy, having a physical therapist treat me, and utilizing the equipment I have access to in my own clinic. If I didn't have access to that, I would have certainly thought I was ready to start running months before I actually was. Last and most important of all of the information you will take today on things that you must have is a support system. I don't care how tough you think you are. You're gonna have moments of frustration, sadness, anger, and discouragement. I'm a physical therapist. I do this for a living, and I've personally now experienced all of it. There will be times when something small feels disproportionately hard, times when your pain lingers and you don't understand why, and times when others can do things you simply can't yet. A good support system matters. Lean on your people, stay involved. Even if you can't participate fully, show up anyways. Inclusion is better than isolation. I don't care how many times I have to tell my husband that my knee hurts, he listens and he supports me, and I feel like I'm allowed to share my frustrations. 8 days after my own surgery, I was the maid of honor in my sister's wedding. Stuff like that is not ideal on the timeline for healing, but I'm very grateful I didn't miss it. Moments like that matter, and getting yourself up and out of the house and participating in things that you value will help a lot in the long run. Focus on what you can do and chip away at progress. This is hard at the preparation phase now as you prepare to go through surgery, but this is something that is going to matter very much in the long run. This is not a 6-month recovery. This is not even a 9-month recovery. It's more like 1 year plus, depending on how your recovery goes. And that is going to wear on you if you do not have proper support. Thank you so much for watching. If you found this helpful, feel free to subscribe or follow along. I've documented my recovery daily from the very day of injury, and I've linked resources and products I've used along the way. If you're watching this because you're preparing for ACL surgery yourself or supporting someone who is, I wish you best on your journey. If you ever have any questions, don't hesitate to reach out. Thanks.